Hi, I'm Raul Santos from the University of São Paulo, Brazil, and I'm here at the EAS meeting in Madrid. And we had very exciting news about the possibility of treatment of FH patients because of the recent results of PCSK9 trials in that population. FH is very common. Of course, homozygous FH is not that frequent, but probably should be more usual than we think. And of course, we deal with those patients have a tremendous difficulty in treating some of these FH patients. Of course, severe heterozygous FH, homozygous FH patients, and despite the fact that we treat them with highest and most potent available lipid-lowering therapy, most of these patients still persist at very high risk of having a heart attack, of dying of atherosclerosis. And I see with very good eyes the results of the Tesla study. There was a result that one of the PCSK9 inhibitors, evolocumab, was tested in homozygous FH population, and on average there was a 30% reduction on LDL cholesterol levels. And when we take a look at the absolute values, was around 100 milligrams per deciliter of LDL that was taken away from the circulation. And in my opinion, that really could make a difference for those patients, because we know that was exactly the amount of LDL that was taken away by the use of statins and other treatments in the South African cohort that was published a few years ago by Derek Raul, and that meant a 25% reduction on the risk of cardiovascular events. So I see that for many patients that really could make a difference, and I hope this drug show to be safe in the long term in order for them to be approved for these patients. And if you take a look of a more frequent disease as heterozygous FH, in my opinion, the studies that have been done so far and show terrific results for those populations, reductions of 50 to 60% on LDL cholesterol levels on top of everything they already give to our patients, and we are able to normalize cholesterol levels in heterozygous FH patients. And for that population that's a lot more frequent than homozygous FH, I think that these drugs will really make the difference for that population. And the thing that we have to do is to make early diagnosis and to treat. And for instance, just to be very quick at what we do in Latin America, we have the Ibero-American FH network that's working very hard in increasing awareness and making the diagnosis of FH patients. And I think we still have a long way to go in our countries, but hopefully we'll be able to make more diagnoses and to treat more patients, and hopefully reduce the burden of cardiovascular disease for them and for their families.